Hello, everyone. Welcome to our Working Well Remotely webinar series. I'm just going to wait a minute or so before we start to let folks log on. It looks like our participant list is going up, so we'll just give it a minute or so before we formally start. But thank you for joining us. Hi, okay. Well, we'll go ahead and get started. Good morning, everyone, and welcome to our UCI Working Well Remotely webinar series. Today's topic is remote work while caring for older generations. I'm Michelle Quint. I am the Executive Director for UCI Health Human Resources, and I will serve as your MC for this session. This session is one of 7 topics that we've created to provide you with some ideas and tips on how to effectively manage during these challenging and unprecedented times. So a bit of housekeeping before I introduce our co-host and our speaker. This is a webinar format, so while you can see our co-host and our speaker, we cannot see you. You'll also notice it's a little bit different from regular Zoom meetings, that there is a Q&A box versus a chat box. So please feel free to submit your questions during the session, and we'll try to get to as many of them as time allows. Also, this session is being recorded, so if you have colleagues who have missed today's live session, it will be available on the Working Well website. With that being said, let's move on to the main event. And first, I'd like to introduce Dr. Steve Goldstein. He's the Vice Chancellor of UCI Health Affairs. And so, Dr. Goldstein, would you like to please tell us a little bit about your UCI experience and why this particular session is of interest to you?
A pleasure, and good morning to everyone. I've been here for 1.5 years. As I say to family and friends, I feel like I've come to paradise, and I just don't mean the weather. I think that UCI is truly an extraordinary institution. And in the challenges that we've been facing with the pandemic, it's just so apparent how we have all stood up to help our communities and to help each other, and the resilience that everyone has shown. And that takes its toll. So I think it's fabulous that we have sessions like this. On a personal level, as a pediatric cardiologist, I am extraordinary at taking care of children. And so I needed to come to talk about taking care of older adults, but also really to learn and to be part of this conversation with the opportunity to listen to Lisa and to join all of you. So thank you for joining us.
Thank you, Dr. Goldstein. I'd also like to introduce our other co-host, Dr. Michael Stamos. Dr. Stamos is the Dean of our School of Medicine here at UC Irvine. And Dr. Stamos, would you tell us a little bit about your UCI experience and why this topic is of interest to you?
Thanks, Michelle. Of course, yes. And I'll echo a little bit of what Dr. Goldstein commented on. So I've been at UCI for now, I'm on beginning my 19th year, actually. Hard to believe, but I know it's true because my son was 6 months old when I started, and he's now off at college, and he's almost 19. So it's easy to keep track of my time here. So I think it's a phenomenal place. I wouldn't have stayed here this long if I didn't. I'm totally committed to the organization and its ethics and its ethos, and just couldn't be prouder of all of us. You know, even before COVID, of course, we had issues with caring for aged parents and aged relatives. And I have some experience with that with my father, who sadly passed a little over a decade ago, and then my wife's father, both of which were challenging because they were living in Florida and we were in California. More recently, I have an experience with my mother-in-law, who is also aging, and she was living in an assisted living facility in Florida also. And it became obvious that that was not a good situation with what was happening in the state of Florida. And so we looked at several options, and my wife has 2 brothers. And so We offered her to come out to California, which was a bit of a challenge for her, not so much for us. But ultimately, she decided to move in with my brother-in-law into his house. And it's really just been amazing to see how the two of them have thrived together in that situation. And we frequently FaceTime with them, and we provide support and help. But we sort of see how he has had to modify his life for that caregiving. So we think it's phenomenal. We're indebted to him for what he's doing for my wife's mother, my mother-in-law. Over 30 years now, so she's like my mother, my second mother. So it's been great. So thanks for asking, and I look forward to learning from the real experts, however. And Dr. Gibbs, well known to most of you, if not all of you, the accolades have piled up over the years for Lisa. I think the most recent one I can remember is Orange County Medical Association Physician of the Year. It feels like about 3 years ago, but my timing is always wrong, so Lisa might correct me. But she's our Chief of Geriatric Medicine and Gerontology, and the Ronald Reagan Endowed Chair of Geriatric Medicine here at UCI. She has a very extensive and successful history of developing multifaceted programs, bringing together collaborators from across the university, across the community, and really partnering with anybody who has shared her passion for caring for elderly populations, and really has led, if you would, population health, in my opinion, from the UCI perspective. As medical director of the UCI Senior Health Center, which is a primary care and consultative practice, she has led the development of a number of innovative programs, including things that were innovative when she did them and maybe aren't as innovative now, like patient-centered medical homes. Hers was, of course, geriatric focused, geriatric subspecialty services, including memory assessment, comprehensive assessment, oncology, telemedicine before it was popular, inclusive of telepharmacy and teleconsults, and a program to support caregivers of patients with dementia through social work interns supervised by a community-based organization. Again, I could go on and on, but I think I'll stop because we only have now 43 minutes left, and I want to maximize the learning from Lisa. Thank you, Lisa.
Thank you so much. And I will thank you for that introduction. I will now share my screen so we can pull up our presentation. All right. So again, really kudos to really our experts in our human resources department for really increasing awareness to this important issue. So today we'll be talking about remote work while caring for older generations. Oh, okay, there we go. All right. So, while COVID has increased the awareness of healthcare providers as heroes due to the pandemic, we also want to recognize the UCI caregivers of older adults. And I also want to mention dependent adults, family members who are staying at home and need caregiving. The pandemic itself has made caregiving much more complex and stressful. And in addition, we mustn't forget those caregivers that find themselves caring for two generations, the older and the younger, hence the reference to the sandwich generation as well. So today what I'd like to briefly cover is demographics of aging, caregivers in terms of what they do and the immense value, the challenges they face, the impact of COVID-19, and we'll end up with discussing some pearls to support caregiving. Okay, so briefly a reminder where we are in terms of the aging population. This graph shows the stunning increase in older adults over the next 40 years and beyond. But just briefly, if you look at 2010, we did have 40 million people in the United States, 65 and over. And 40 years later, hence at 2050, we will have doubled to 80 million people, 65 and over. And currently, we are also seeing a steep rise in the population 85 and over. So clearly, we're also seeing this in our healthcare settings. Let's speak about the situation a little closer to home in Orange County. The graph before you shows the incredible growth here in Orange County. The only line that you see rising upwards is the aging population. All other age groups in Orange County are on the decline. So by 2045, the older adult population in Orange County will be at 17%, which is almost 1 in 5. And just a brief mention that our Division of Geriatrics is a part of the Orange County Steering Plan for Aging, and we are representing UCI on the steering committee. Okay. So who are the caregivers? Well, this is a survey by AARP giving us a snapshot of over 1,700 persons, showing that the caregivers, 39% are men, but the majority are women at 61%. Of the age and generational focus, we have most of the baby boomers. At this point, 34% are caring for older adults, followed by the Gen X, but also the Gen Z, the millennials, and silent, which I had not heard of before. Okay. 45% of our caregivers have at least one negative financial impact. And of course, what's relevant to this conversation today is that 61% of our caregivers are also working elsewhere. The average duration of caregiving is 4 to 5 years, and 3 out of 10 caregivers have provided care for over 5 years, and 6 in 10 of those employed caregivers work full-time. So that's 60% of our caregivers who work full-time, and then also go home and provide almost another full-time job equivalent of caregiving at home. Okay. This is a snapshot here of, what the caregiving entails. So again, the average hours per week is 74 hours per week, 24 hours per week. And what do our caregivers do? Well, we really in geriatrics break down these tasks to IADLs and ADLs. IADLs are things like helping with money management, transportation, arranging medical care and other services, preparing meals, and paying attention to fall prevention. And then as the care becomes more acute, we move into the ADLs, and people may need assistance with transferring, with eating, with toileting, and assistance basically with basic needs. And I will point out on this particular picture that Alzheimer's and dementia are one of the top 3 reasons for caregiving. And that leads us into our next slide. If we look at the Alzheimer's Association facts and figures for 2020, we see the absolute stunning numbers of caregiving for patients with dementia that are occurring. So in the US, last year, 16 million family members and friends provided more than 18 billion hours of unpaid care at an economic value of $244 billion. Also on the slide, we see that in California alone, for the same time period, we have 1.6 million caregivers providing more than 1.8 billion hours of unpaid care at a value of $24 billion. So the value of caregiving and unpaid caregiving is immense for our citizens. The challenges that we see mostly in a clinical setting are delays in medical care. And I'm referring to delays in the caregiver's medical care. We have so many instances where our caregivers with chronic conditions such as diabetes and hypertension, et cetera, just are unable to really stay on top of the need for managing their own chronic condition because they're so busy taking care of someone else's chronic condition. I've also had many instances where, caregivers finally come in when they have a break or no longer caregiving, and then they start to, get their preventative care and unfortunately find out that they've had, a colon cancer or some other type of cancer brewing that they have not, been able to address before. So these are pretty serious challenges as people are stretched. In terms of financial concerns, this always comes with a sacrifice financially as well. And 45% of those surveyed noted also that, the ranges of the financial impact range from the inability to continue saving, to increased debt, using up savings, or even having unpaid bills and having to borrow money from family and friends. The mental health impact is absolutely extensive. The rates of anxiety and depression are very high in caregivers, and especially those caregivers of persons with dementia. In one study showed that 30 to 40% of family caregivers of persons with dementia reported anxiety and depression, compared to 5 and 17% of those caring for people without dementia. And finally, you know, again, it alters careers. Some people have to make the very, very difficult decision to stop working, for instance. And it impacts people's life course, you know, potentially about where they would like to live if they have to move in with a parent, for instance. So just being a caregiver presents, you know, several challenges that are hard to navigate in a normal situation. And then in terms of our workforce, the same study from AARP showed that 53% had disclosed their caregiving role to a supervisor, and 34% had either not felt the need to disclose that or were afraid to disclose the fact that they also had, you know, a separate role in their life. And 13% said that they were not sure if their supervisor knew this or not. This becomes important though, because, you know, caregiving eventually impacts work in some way. And we see that disclosure may actually lead to a more understanding work environment. We can talk about that a little bit later. Okay. So what were the impacts on employment? Again, they can range from very minor to very major situations. In some cases, it might just be a matter of going in late once in a while, or leaving early, or taking some time off. It could also lead to leaves of absences. You know, if the person they're caring for needs to be hospitalized, for instance. But people end up, you know, also having major consequences, like turning down promotions, giving up work entirely, or retiring early. So this truly has an impact on our workforce, and it behooves us to work with, you know, our employees who are also caregivers to benefit our institutions as well. So here we are, and enter COVID. So we're going to talk a little bit about how COVID has also made the situation more complex. This figure is from the Orange County Healthcare Agency. As of last weekend, we had 1,264 deaths in Orange County. And if we do the math, we find that 74% of those deaths were in people over 65, and 32% were in persons over 85. So clearly disproportionately impacting older adults throughout the country, well, and the world. So the stress level for, you know, dealing with COVID, you know, has increased with everyone, but particularly caregivers. You know, the overall concern is, how will I keep, you know, my loved one safe? And if I get COVID, or we have COVID within the family, how will we prevent this exposure to the older adult? We've also had multiple families with increased stress due to the fact that their loved ones may have been in the hospital, the nursing homes, the assisted living facilities, because of course the visitor guidelines have been impacted. In the nursing homes and assisted living, those institutions basically just locked down in an effort to keep COVID, you know, outside their walls. But what this did is it meant that, you know, they couldn't have visitors. So again, we've had patients in our senior health center with where our patients are in the nursing homes, but the family members are suffering because they can't visit, and patients sometimes, you know, experience worsening memory, worsening agitation, worsening confusion because they don't receive those visits and that care from their family members as well. So this has really also had a lot of negative impact on medical conditions of older adults. And of course, continuing medical care. We've seen, you know, especially early on in the pandemic, where people were just delaying care, choosing not to come in. And we addressed that, of course, by being available through telehealth especially to places like our assisted living facilities, who fortunately have support within the facilities to help patients with a telehealth. The other potential impact for those caring for loved ones at home is that, they may have had an in-home or paid caregiver, which because of COVID couldn't come anymore, either because they were sick with COVID or because, they were afraid of bringing anyone into the household who may have had contact with someone else. So, in this situation, even the paired caregiver assistance was no longer available. And, another big impact is that we had closure of senior centers and daycare centers. So, normally pre-COVID, many times our older adults would go to daycare centers for dementia care or senior centers during the day, and it would provide a wonderful outlet for both the caregiver and a wonderful social stimulation for our care recipients. But with the closures of these centers, all of a sudden everyone is just at home all the time. In fact, I have one patient who's older with developmental delay, and he has actually become extremely agitated and aggressive towards his sister, who's his caregiver, because that outlet is no longer there. So we are seeing the impacts of this on a daily basis. Okay, now working remotely. So great. I mean, there's some upsides, there's some downsides, but let's talk about either of them. So there's no commute. I think we're all happy about the lack of a commute. But along with that, there's some other problems. Somehow no longer do we have this natural work-home boundary. You're either always on at work or always on at home all at the same time. In addition, a lot of people have noticed lack of activity, unhealthy eating habits, and probably for most, poor sleep. So while there are some silver linings here, there are also some increased stressors that we may not have anticipated. So moving on to really managing that balance of working at home and also caregiving, I've put together some pearls of wisdom to hopefully guide people to support that caregiving and work balance. So let's review some of these. Number one would be to schedule effectively. We know that, people who need caregiving are better off on a structured schedule, especially with medication administration, for instance. A structured framework provides that stability, especially for people with memory problems. It really helps to have a daily routine where people can anticipate the same things will happen at the same time. And that really helps to control the agitation. So this is true for almost any chronic condition. I've mentioned dementia, diabetes, but it's true for heart failure, issues with toileting, and medication compliance. So again, the more structured a schedule one has and one can anticipate, the less often I think there will be disruptions and difficulties. And by the same token, being able to have a work schedule where certain work objectives are met with the caregiving needs in mind. So really thinking that out on a daily basis and potentially keeping your supervisor and coworkers in mind. letting them know what's going on is really helpful to sticking to a schedule that works for everyone. Number two, setting boundaries. So all of a sudden you're at home and people may think, that life is all grand because you're here, but we have to let our loved ones know that we're home, but our work responsibilities continue. So there are times when we're off limits if possible. And there are boundaries at work too, because a lot of my colleagues and people in at least our geriatric administration office, we've realized are actually working more being at home. So avoiding that tendency to feel like you need to overwork is another pearl. And also, again, if you need flexibility, it's great to be able to be open with your supervisors and colleagues. And if you need to, ask forgiveness in some days. But setting boundaries is particularly key to being able to focus. Next, communicating clearly. So, you know, we know that caregiving can have a structured schedule, but also can be highly unpredictable depending on, you know, our loved ones who need caregiving. And this is especially true with patients with dementia or people that have fall risk. You know, you may be in the middle of something and all of a sudden someone, you know, gets up to walk into another room and falls. And all of a sudden your attention is needed immediately. So these things do happen. And so that's why we, you know, it's almost easier to be open with your colleagues and supervisors. Some of the advice also is to over communicate, because we can't assume that our supervisors and our peers really do understand our situation. And most of the time they would be, you know, want to really be helpful if they did know what we were going through on a daily basis. Okay. All right. And finally, self-care. So time management is key. Also reducing exposure to COVID. So I know a lot of us have started to depend on the home delivered services with regard to groceries and other basic necessities. Definitely taking advantage of our medical system's opportunity and ability to offer telehealth so that you can, you know, reduce again the disruption of transportation, but still continue to have medical care. COVID precautions, you know, without a doubt, but also many people advise limiting the news. The news really does contribute to anxiety and depression. And many people have found that if they just limit the news or just turn off the news, that they're much more at peace. In terms of lifestyle, you know, again, so much more important even now to stay hydrated. Remember to go outside and remember to try to get some exercise and take time for yourself. So these are basic self-care, and I know they're not really sometimes news to people, but if you're in a caregiving role, these are incredibly difficult sometimes to remember, and not only remember, but to implement. So, and again, if the caregivers don't stay healthy, then everybody suffers. So it's incredibly important to take care of yourself. And, you know, also I wanted to mention the importance of staying connected. And this is not only true in a normal caregiving situation, but especially during COVID. What people don't realize is the dramatic negative effect on their health. One of our studies that we quote quite often shows that a lack of social connection and feeling of loneliness are as damaging to one's health as smoking 15 cigarettes a day. So that really brings it home to many people who now clearly understand the effects of smoking. And we also know that chronic loneliness is associated with a higher number of chronic illness and higher depression scores. So this is even more critically important to realize during the time of COVID. I want to be close to the end here to talk about one of our geriatric program responses to COVID and social isolation. Through one of our grants, we were able to quickly organize an assist program. Our medical students and our nursing students, you know, all of a sudden found themselves out of class, and most of them really wanted to help in any way that they could. So we were able to organize a group of students who were willing to reach out and be telephone buddies to anyone who felt isolated and really wanted that social connection. So we've had 70 UCI School of Medicine and School of Nursing students paired with older adults since March. And this service continues in also Vietnamese, Mandarin, and Spanish. And I won't review this in detail, but if you know somebody who is isolated and who would like to partake of this program, the program referrals can be sent to Nika Seville at the email noted on the slide. And also for our future students, this really helps them develop a bedside manner, because we do give them training prior to joining the program in how to speak with older adults, understanding the importance of social determinants, and also we arm them with a lot of resources, which some of our seniors need. So again, I think one of my main points in presenting today is really, just bringing caregiving kind of out of the closet, right? COVID has really propelled us in ways that we never thought imaginable before, such as telehealth. And I think also it has the ability now to help us increase our awareness of the roles of caregivers. COVID will pass. It may not feel like it, but it will. But again, the societal response to our aging demographics will continue for decades to come. And we will have more and more people who are fully and gainfully employed who will now be asked to take that caregiving role. So we have the option too, as employers, to choose to support our caregivers with understanding, support, and flexibility. And hopefully that, caregiving can be an open discussion on a much larger scale, no matter if people work here at UCI or elsewhere. And finally, I just wanted to remind folks that we have a special center for older adults at the medical center on the Orange campus called the Senior Health Center. And we are here to help, so please keep us in mind for your medical care. And with that, I will end. Thank you.
Fantastic. We have a few questions in the Q&A, but I'd like to lead off with a question for you, Dr. Gibbs, if you don't mind. Thank you for your pearls. I found them very, very helpful, and I try to live by some of those. Not always successful in all of them, of course, but it's a challenging time now. But any advice, any pearls, any learning, experiences when you deal with a caregiver? It's often a relative or a family member. It's often a child caring for an older parent or an infirm parent. Any advice on how they can interact with their siblings to try to help distribute the responsibilities? Not that they all have to be there physically, because sometimes one person has the ability, the others don't, but there are other ways to contribute to the situation. Any advice on how that, you give your patients or your patients' children advice on how to address those issues?
Yes, I mean, we quite frequently ask them first about caregiver burden, but then that leads to the discussion on who could potentially provide some respite and who can also share that responsibility for caregiving. So we do have those conversations, and oftentimes it's really a matter of the sibling stepping in to provide some free time for the primary caregiver. Maybe hosting or having a visit with the older adult, and so yes, those are key questions. Unfortunately, one of the things we find happens so is that the older adults tend to be moved quite often from family to family to family. And sometimes that's not really in the best interest of the older adult. So we do have all of those discussions. Thank you for that question. Because sometimes we have to prompt the primary caregiver to really have that discussion because they feel uncomfortable doing that.
I have a question that I'm not sure there's a ready answer to, but if you have someone who's aging and is no longer really safe in the home, but they really don't want to leave, how do you have that conversation in a way that maybe changes it? And if you know it's unsafe, how do you go forward with maybe insisting on a placement?
Well, we always let people know that we're on their side. We want them to live independently in the way they desire as long as possible. But when it comes to safety issues, sometimes we try to frame it such that, we want you to stay living independently, but in order to do that, we need to bring in a caregiver, or we need to do X, Y, or Z. And unfortunately, if we cannot do that, then in your best interest, you'll have to move. So we always try to make sure they know that we're really on their side, but these are decisions that are really not up to us. This is the situation at hand, and try to give at least that a couple of options. Yeah. Now, if somebody's suffering from dementia, however, and they just lose that capacity, then then basically we have to come in and be more proactive about it.
And in the state of California, what are the legal steps that would be required in such a case?
So to determine capacity, we need, a formal neuropsychological evaluation, either by physician or psychologist, to determine that capacity, the person doesn't have that capacity determined. There's a number of issues one can determine, ranging from voting to determining, medical care to managing money. So it gets quite complicated. And sometimes people have capacity for one thing, but not for others. So we evaluate that frequently for families. But essentially that's a medical evaluation to determine the legal capacity. And then they go from there.
Dr. Gibbs, there's a number of questions. I'm going to run through a couple of them fairly quickly. Someone asked about IDL versus ADL. Is there a distinction there?
Yes, the IADLs, I like to think of like our instrumental activities of daily living. Those are the things we learn when we're college students. We leave home and all of a sudden we need to do for ourselves. We need to wash our clothes and clean up our house and, manage our money and go to the grocery store. So things that we interact with in the community. ADLs are activities of daily living, and those are much more basic. Those relate to just transferring, toileting, actually the actual act of eating. They're just the very basic needs for us to survive.
Great. And there were some accolades about the ASSIST program, and one person that wanted to volunteer for the ASSIST program. They've been a caregiver for their parent who passed away. They'd like to volunteer. They also want to know if you have a need for people to mentor or to be a support for current caregivers. So that's on the chat. If you want to give an answer now, and then maybe we can hook up Karen Lampe with you, Lisa.
Yes, and also if you want to, Nika Seville's email is on that one of those slides. You can either direct those questions to myself or to Nika, who runs the program.
And then a question that's an interesting one. I've heard both sides of this equation, which is, how do you deal with an elder parent that's not taking the pandemic as serious as you would like? I've seen the opposite, which is that the parent takes it so seriously that the children feel a little bit of stress because the mom won't interact with them because of fear of the pandemic.
I have too. I mean, we've noted in our patient populations that senior health that our older adults are by the majority following the guidelines of taking this extremely seriously, and I think that's why we're not seeing high rates of COVID among our population. But if you have an older adult who's not taking it seriously, and they live in the same household, I think that's a really tough situation. If they have the capacity to make decisions, but they're just not worried about it, I mean, I think you just need to focus on taking care of yourself, really. Unfortunately, there's no way to force people to take it seriously.
An interesting question about palliative care. And what is the role of palliative care? When can it be called in? What's the right time frame? Some of us have a historic notion of what that means. I think that's changed, particularly in patients with dementia or other diseases of aging.
Right. Palliative care is now becoming its own field apart from hospice. So we have to be, careful about these definitions. So hospice is truly end-of-life care, and that's defined as really 6 months of life. Really, for someone to be eligible for hospice. Palliative care is really reducing suffering on a chronic basis. So palliative care doesn't necessarily mean that somebody's at the end of life. Palliative care can just be reducing the suffering from pain from medical conditions. So very different. And anytime someone is suffering and we don't have a cure for that suffering or that pain, and they need to really help the pain level, or they really need to mediate that pain level better, we do recommend palliative care.
Keep the questions coming. So any pragmatic suggestions of social interaction that seniors at home can do, particularly if they don't require caregivers, so they're alone and probably lonely, worried about the pandemic, they don't get much. So what can they do? What have you seen that works well? What could you suggest?
So, you know, having internet access is really key to a lot of seniors. In fact, I have one patient I just had a video visit with last week. He plays online games with people around the world. I think he's on his 18,000th game. And so he hasn't really, you know, felt the effects of COVID as much as someone else who doesn't have that hobby or that access. So I think people with internet access and phones are, you know, basically have a lot of different ways to deal with the loneliness. But we do find people that actually don't have internet access, and we're finding more and more that shuts people off to the world. In fact, in our social determinants of health, I would argue that we need to start including access to the digital age. You know, for folks that, you know, have like support groups that they used to attend pre-COVID, you know, recognizing that those groups and those social activities for the most part are now available virtually. So, you know, again, that access is incredibly important to continue in your life, albeit in a modified way.
Lisa, you talk about the power of the internet to keep us connected, but I worry a little bit about safety. Certainly my father, who is 90, gets phone calls offering to sell him things, and very often he thinks they sound great. How can we help protect them when they're online?
That's a fantastic question. And I appreciate that also mostly because we do operate a center of excellence on elder abuse and neglect in geriatrics. And so we do know that, you know, the risk for financial abuse is even higher now online and via the telephone than it was pre-COVID as well. And, you know, even people that have completely intact intellects and memory, you know, are susceptible to these criminals that are actually really very good at what they do. So I think prevention and education is really the key. And, you know, there's a lot of guidelines out there about only answering emails that you solicit or answering emails from people you know and so forth. But
are there ways that we can sort of protect their computers, or it's almost like what we do for children in terms of limiting access to certain sites? Or,
you know, I bet that you could. Some of the software that I know about, you know, actually has names that pertain to the younger generation. But that's a great idea. I bet you could apply those to the computers of older adults, you know. Yeah.
Well, Dr. Gibbs, we want to thank you wholeheartedly for this excellent program. Michelle, thank you, and to HR for hosting this. Michelle, there was one question about how people will get access to this if they didn't catch the whole session, or if any of their colleagues want to watch it. Will that be sent out as a URL, or will it be on the website?
Yes, thank you, Dr. Stamos. There is a Working Well website where we have all of the webinars that we have hosted thus far, all of the recordings. So we can send that out to participants at the conclusion of this session. And then it'll also have the slide deck presentation that Dr. Gibbs presented. So with that, I want to thank everyone for joining us here today. That was an incredibly informative and exceptional session. Thank you, Dr. Gibbs, for your presentation, and thank you for hosting Dr. Stamos and Dr. Goldstein. I do want to remind everyone that there are 3 more webinars in the Working Well Remotely series that are coming up. They are here on your screen. They are the next few Tuesdays in October with different topics and some very exciting speakers. So thank you everyone for spending time with us today, and I hope that you are well. Bye-bye.
Thank you.